I'm a psychiatrist, and as we mark May Mental Health Awareness Month, I wanted to share with you a tool that we commonly use in psychotherapy to achieve a number of goals. The tool is analogies, and we can look at two functions of analogies in therapy. One is to help establish the therapeutic alliance, that is, the relationship between the therapist and the patient, or the therapist and the client. And two is to help the patient understand more easily, with clarity and accuracy, the events of the stressful situation that may have brought the patient to that therapy session. And so, if we can pick an analogy that we can use today to help us understand how our emotional system works. So, we can use, for instance, the digestive system. So with the digestive system, it starts with your mouth and ends in your rectum. You put in food and it gets into the digestive system. Part of that food is going to be absorbed, and it's going to be your nutrition. And that is going to help you grow, to help you develop, to help you thrive. Part of the food is going to be defecated. So if your digestive system gets blocked, so we're talking about constipation here, and the food gets stuck in your rectum, it can make you feel very uncomfortable, and the discomfort can be very unbearable, to the point that you feel distressed, you feel overwhelmed. And if you try to eat something else, you're either nauseous or you vomit the food. So you can't take any more because you have to get rid of what you're supposed to get rid of. And so there are other interventions, there are many interventions that you can use, enemas. Sometimes if it's very severe, you might require surgery. Now, if we take that to our emotional system, is that as we go on with life, we're going to encounter lots of different emotions. Some of them are going to be very distressing, some of them are going to be nourishing. And if we get into situations where there are difficulties, adversities, challenges, then parts of those challenges we're supposed to absorb so they can build us, so they can nurture us, so they can help us grow. And parts of them we've got to let go, and we've got to have an outlet for it. So sometimes that outlet gets blocked. And so you find yourself constipated with emotions that you're not supposed to be carrying. And that means you require some intervention to help you create an outlet for those things to go out. And therapy can help with that. Or if you're aware of it and you're able to process it by yourself now, then you know which feelings you're supposed to let go, which emotions you're supposed to defecate, which thoughts you're supposed to get rid of, to be able to maintain a healthy emotional system.